There are several different approaches for a potential vaccine against the coronavirus. The basic idea is that you would get a shot that contains faint versions of the virus. The vaccine would expose your body to a version of the virus that is too weak to cause infection, but just strong enough to stimulate an immune response. Within a few weeks, cells in your immune system would make markers called antibodies, which would be specific for only the coronavirus, or specifically its spike protein. Antibodies then attach to the virus and prevent it from attaching to your cells. Your immune system then responds to signals from the antibodies by consuming and destroying the clumps of viruses. If you then catch the real virus at a later stage, your body would recognize it and destroy it. In other words, your immune system is now primed.
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future.
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane.
What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated?
Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications.
Every time you breathe in, air travels down the trachea through a series of channels called bronchi and finally reaches little clusters of air sacs called alveoli. There are some 600 million alveoli in the lungs, adding up to a surface area of roughly 75 square meters, the size of a tennis court. These tiny sacs, only one cell thick, facilitate a crucial exchange, allowing oxygen from the air we breathe into the bloodstream and clearing out carbon dioxide. Pneumonia wreaks havoc on this exchange. Pneumonia is an infection of the alveoli that causes them to fill with fluid. There are many different kinds of pathogens that can cause pneumonia. The most common ones are viruses or bacteria. These microscopic invaders enter the body via droplets either in the air we breathe or when we touch our eyes, noses, or mouths after touching a contaminated surface. Then, they face the respiratory tract's first line of defense, the mucociliary escalator. The mucociliary escalator consists of mucus that traps invaders and tiny hairs called cilia that carry the mucus toward the mouth, where it can be coughed out. But some of these invaders may get past the mucociliary escalator into the lungs, where they meet the alveoli. Because alveoli serve as critical exchange points between the blood and air from the outside world, they have their own specialized types of white blood cells, or macrophages, which defend against foreign organisms by enveloping and eating them. When pathogens enter the lungs, the macrophages work to destroy them. The immune system releases additional white blood cells in the alveoli to help. As these immune cells fight the pathogens, they generate inflammation and fluid as a byproduct of the inflammation. When this fluid builds up, it makes gas exchange inside the alveoli much more difficult. As the level of carbon dioxide in the bloodstream begins to rise, the body breathes more quickly to try to clear it out and get more oxygen in. This rapid breathing is one of the most common symptoms of pneumonia. The body also tries to force the fluid out of the alveoli through coughing. Determining the cause of pneumonia can be difficult. But once it is established, doctors can prescribe antibiotics, which may include either antibacterial or antiviral treatments. Treatment with antibiotics helps the body get the infection under control. As the pathogen is cleared out, the body gradually expels or absorbs fluid and dead cells. The worst symptoms typically fade out in about a week, though full recovery may take as long as a month. Otherwise healthy adults can often manage pneumonia at home, but for some groups, pneumonia can be a lot more severe, requiring hospitalization and oxygen, artificial ventilation, or other supportive measures while the body fights the infection. Smoking damages the cilia, making them less able to clear even the normal amount of mucus and secretions, let alone the increased volume associated with pneumonia. Genetic and autoimmune disorders can make someone more susceptible to pathogens that can cause pneumonia. Young children and the elderly also have impaired clearance and weaker immune systems. And if someone has viral pneumonia, their risk of bacterial respiratory infection is higher. Many of the deaths from pneumonia are due to lack of access to healthcare. But sometimes, even with appropriate care, the body enters a sustained fight against the infection it can't maintain, activating inflammatory pathways throughout the body, not just in the lungs. This is actually a protective mechanism, but after too long in this state, organs start shutting down, causing shock and sometimes death. So how can we prevent pneumonia? Eating well and getting enough sleep and exercise helps your body fight off infections. Vaccines can protect against common pneumonia-causing pathogens, while washing your hands regularly helps prevent the spread of these pathogens and protect those most vulnerable to severe pneumonia.
So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the Severe Acute Respiratory Syndrome coronavirus, first identified in China in 2003, the Middle East Respiratory Syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth.
Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for.
A tube is inserted into the patient's trachea to pump air directly into the lungs, with a series of valves and branching pipes forming a circuit for inhalation and exhalation. In most modern ventilators, an embedded computer system allows for monitoring the patient's breathing and adjusting the airflow. These machines aren't used as a standard treatment, but rather as a last resort. Enduring this influx of pressurized air requires heavy sedation, and repeated ventilation can cause long-term lung damage. But in extreme situations, ventilators can be the difference between life and death. And events like the COVID-19 pandemic have shown that they're even more essential than we thought. Because current models are bulky, expensive, and require extensive training to operate, most hospitals only have a few in supply. This may be enough under normal circumstances, but during emergencies, this limited cash is stretched thin. The world urgently needs more low-cost and portable ventilators. as well as a faster means of producing and distributing this life-saving technology.
Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition.
Like other vaccines, such as the flu shot, COVID-19 vaccines will be given with a needle. This triggers an immune response in the body, which is the body's natural way of defending itself. The vaccine will strengthen your immune system by training it to recognise and fight against the virus that causes COVID-19.
Influenza vaccines are able to trigger an immune response by mimicking viral infection.
Vaccines may contain either killed or weakened versions of the virus that causes the disease, or a small part of the virus, such as a protein.
They are usually manufactured using inactivated or killed virus particles taken from various circulating influenza strains. Inactive fractioned viral components contain the subvirion particles hemagglutinin, HA, and neuraminidase, NA. In Canada, influenza vaccines are administered via intramuscular injection. These fractioned particles containing the foreign antigens hemagglutinin and neuraminidase are released from the vaccine into the bloodstream.
There is no risk that you will get the disease from a vaccine. When your immune system recognises this virus or parts of it in the vaccine as being foreign, it responds by creating memory cells and antibodies that will protect you against future infection or disease. As a result, you'll be less likely to have severe COVID-19 symptoms after a vaccination.
There, they are met with an immune response mediated by various immune cells, including macrophages, T lymphocytes or T cells, and B lymphocytes or B cells. A major mechanism of action involves macrophage phagocytosis of hemagglutinin, breaking it into smaller components. After ingestion, macrophages display the hemagglutinin antigen on their surface in combination with a specific receptor known as the major histocompatibility complex, or MHC. T cells are now able to recognize and bind foreign antigens that are associated with the MHC. Upon binding to the MHC receptor, T cells become activated and proliferate into either cytotoxic T cells, regulatory suppressor T cells, or helper T cells. Activated helper T cells express hemagglutinin receptors specific to the vaccine strand on their surface and play a major role in antibody generation and memory B cell activation. Unlike T cells, B cells are able to ingest hemagglutinin independent of the MHC. Once internalized, B cells process the hemagglutinin antigen and present it on their surface in combination with an MHC. When activated helper T cells interact with activated B cells expressing antigen MHC receptors, they begin secreting lymphokines which have several effects. Lymphokines trigger activated B cell proliferation, which leads to either their differentiation into memory B cells or into plasma cells. Plasma cells produce hemagglutinin antibodies specific to the strain of influenza contained in the vaccine. Memory B cells aid in future immune response when exposed to an active influenza virus. When an infected host sneezes towards an uninfected person, the nasopharynx is exposed to aerosol droplets containing whole, live influenza virus. Once inhaled, the influenza virus attempts viral colonization of nasopharyngeal epithelial cells. Assuming that the vaccine strain matches that of the live virus, hemagglutinin antibodies block viral attachment of live influenza virus to host epithelial cells, and overall disease is either avoided or diminished in severity.
So the main question that everybody has is why and when is oxygen needed in COVID infection? Now, as you are aware, COVID infection is divided into mild, moderate, severe categories. The ones who have mild disease will not require oxygen. The ones who have moderate and severe disease, however, will require oxygen at different levels. So this is the indication for use of oxygen in COVID-19 infection when people have moderate, severe or critical illness because of it. Secondly, Everybody wants to know what are the symptoms that indicate that oxygen is required. So for a lay person who's sitting at home and who has COVID infection, how do they know? So there are two very clear-cut things. One is your breathing rate. Respiratory rate more than 24 breaths a minute. Or your oxygen level as measured with a pulse oximeter, which we are all familiar with now. So if a pulse oximeter says oxygen level less than 94%, then these are both indications for requirement of oxygen after medical evaluation. If you have fever and cough and you're otherwise comfortable sitting at home, that is fine. You must always be in touch with a healthcare worker, of course. But what about home? What are the indications of using it at home? Now, one thing to remember is that oxygen is like a medicine, and it is something as a pulmonologist I recommend often for patients with chronic lung disease like COPD and interstitial lung disease. And the indication there is very different. They will be using oxygen in the long term. In COVID, we are dealing with a situation, with an illness that will rapidly change, rapidly evolve, and the patient can rapidly deteriorate. And that should not be. We should not give oxygen at home and feel complacent that we have given the treatment. It's very important to understand that if a person's oxygen level is dropping, the care he requires can only be provided in hospital. The care and the evaluation. So that should not be confused. But yes, what is the role of oxygen at home, in the home setting? One is that in Gurgaon, obviously we all live in societies, and many RWAs, resident welfare associations, have taken the onus of procuring oxygen cylinder or concentrator and keeping it in a centralized area in case there is any emergency situation with any resident. And then the oxygen can be provided while waiting for the ambulance to come and take the patient to a healthcare service, to the hospital or to a COVID care center. So that is definitely one situation where oxygen can be kept as a safety net. Second very important thing is that we are seeing a lot of lung changes, a lot of pneumonia because of COVID. And when these patients recover and we discharge them home, they obviously receive oxygen in hospital, but when they go home, they may also require oxygen. So that is an important point to note, that post-COVID recovered patients who go home may require oxygen for a period of time, something like 2 to 4 weeks. It may be much lesser also, depending on the severity of the illness. So that is another situation where oxygen has to be provided at home, and one must therefore know all the ways of giving.
The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice.